Hello, everyone, and welcome to the HR Verdicts Podcast. My name is Renee Trotman, and I am your virtual HR advisor, counsel, and host for this podcast. In today's episode, we are talking about mental health and well being. Today, we are tackling what is a powerful truth: wellness and mental health and well being. Wellness has become now compliance. Mental health awareness isn't just a cultural initiative anymore. It can also now become a legal one if not managed adequately and appropriately. Let's talk about how this connects into labor and employment law. When we look at the ADA, the Americans with Disabilities Act, and we look at the FMLA, Family Medical Leave Act, and any state leave protections that are there, that already lets you know that when we think about mental health and the increase that we're seeing, that there are plenty laws that may protect your employees and you as an employee or employer. Let's look at this in terms of a more realistic example to draw and connect the points. Let's say that as an employer, you have an employee that is mentioning stress, panic attacks, anxiety at an all time high, challenges with mental health. That can potentially count as a request for accommodations. Now, in and on the HR Verdicts podcast, we have talked a lot about the Americans with Disabilities Act. We've talked about accommodations. We've talked about reasonable accommodations. And I think what's really important here is that we have been provisioned over time, again, to think of this as solely a cultural initiative. Mental Health Awareness Month rolls around, and we have special initiatives and projects and processes that help us really create awareness around mental health. Now, that's great, and that's all good and well until it's not, meaning that that is one aspect and 1 month out of the year where we have everyday instances where employees are claiming that they are having anxiety and issues like stress and panic attacks that are creating havoc on their mental health and well being. And so, one of the things that you always hear me talk about, especially under the ADA and the FMLA, as noted, and other state leave protections, anytime there is a note to things like stress and anxiety and panic attacks, this could be leading to a request for accommodation. You've heard me talk about that employees do not have to directly tell you that they're looking for an accommodation or a leave. An employee can be just saying things in conversation to you that seem to be just part of typical conversation that in and under the law could be constituted as putting you as the employer or people manager on notice and therefore could require an accommodation such as a leave. Statistics show under the EEOC that in 2024 that data around mental health related disabilities claims went up over 30%. You heard me correctly, over 30%. So what does this mean? This means that there is again, a need, a powerful truth here that organizations need to begin to figure out how to better manage, assess, and support employees who are having mental health concerns. With this increased statistical data of EEOC disability related claims around mental health specifically, because disability is very wide and encompassing, but to show data that mental health disability claims under the EEOC in 2024 went up over 30%, This means that we have to ensure that we're paying close attention and that we are equipped and trained as managers and organizations to support this and HR teams and departments. So, when we think about this even further, where does this go wrong? Where do people managers go wrong? Where can HR go wrong in this situation? There's a lot of ways that this can go left and sideways. The first is you've heard me talk a lot about this through different snippets and segments that a lack of manager training is going to be probably the number one area in situation in segment where this goes wrong under the HR umbrella. HR employees and practitioners are going to be well versed in how to support people managers with this. But HR practitioners in departments and teams are not working with employees day to day the same way that managers are. So, people managers must be trained. They must be trained to treat mental health statements not as performance issues. Oftentimes, the two are combined, meaning that people managers often think that this is creating a performance issue, and therefore it is just a matter of performance managing. Well, that's where we can go wrong. So, people managers cannot not be trained, number one, and two, they cannot just think of it as a performance issue. There's also potentially where this can go wrong a failure to document or engage in what we know as the interactive process. Well, you've heard me talk a lot about the interactive process. You've heard me say it's very layered, it's very complex, and there's lots of aspects and components to this that have to be managed. So that's where this can go wrong if there is no documentation of engaging in the interactive process. Additionally, this can go wrong if there is not a discussion around the risks associated with this. For example, wrongful termination, retaliation claims. You've heard me talk all about some of these pitfalls that organizations and people managers can very easily fall into. So, what's important here? What's important to know is that this can go wrong and go sideways very quickly, and it can also create a compliance issue and also a legal issue. Now, how do we work to support this? We need to ensure that through training and documentation that we are adequately supporting employees when these issues arise. There's three steps that we can think through very quickly. One is first to listen with an open mind and an open ear. We, as people managers and organizations, cannot be closed off and say, here we go. They're using this as a blanket statement. They just want to make an excuse to be absent. It's not true. Well, I'm sorry to say that, albeit, yes, there are some people who have abused the system. Okay. But this is not everyone. And therefore, as organizations and people managers who have a duty and an obligation to be good stewards over the organization and to ensure that employees' rights are not infringed upon, we have to very much make sure that we are taking the opportunity and our responsibility, very important, to listen and listen intensely and listen intentionally and listen carefully. That's one. The second step is going to be to document. Now, this isn't about documenting a full expose. It is about making sure that we're documenting key things: the date of concern, the date that the inquiry was made, the date that the statements were made. This is who's involved, what is being asked, what was said, so that you have a baseline not to manage this on your own, but to be able to work in tandem with your HR expert. your HR department, your HR practitioner in your organization. Now, if you don't have one, this is where my statements are always you need to, even if you don't have an HR expert in house, you need to have an HR expert on speed dial so that they can talk you through and guide you through the necessary steps so that you don't put your foot into a pitfall that can cost you big later. And the third thing is to engage. And this is where even things like the interactive process are going to be so important and key. It's having conversation, oftentimes, especially when it relates to mental health and well being, there is going to be ongoing support that is needed. And so it is important that we are, again, duty and obligation as an organization and a people manager, ensuring that we are following up, that we are not just engaging initially on the first time, that we are also re engaging as many times as necessary to ensure that we are able to support the employee. Now, this isn't just a one blanket, there's no recourse to the employer if potentially this is impacting performance. This is why the interactive process and engaging and re engaging with the employee to have dialogue is going to help ensure that if there is a need for an accommodation, that they are able to use that accommodation. And here, employers, is your safeguard the importance and necessity to a reasonable accommodation is to be able to provide the employee with the tools, resources, and or support that is needed to then be able to meet the essential functions of their role. There it is. So, in the event that these conversations are had and there's still challenges, that can then be unpacked further at that time. Now, there is also some things that managers and organizations can do to help navigate this. In the event that these comments come up in casual conversation, in one to one meetings, or hearing through what I call the workplace grapevine. When you hear this, you can say, "Thank you for sharing. Let's talk about how we can support you," versus not saying anything, not addressing it and ignoring it, or potentially saying, "I'm so sorry to hear that, not sure what we can do." What we want to be able to demonstrate from a contemporaneous notes perspective and history perspective is that when we became aware and knew of this, either directly or indirectly through hearing, visually seeing, being told, observing, that when we went unnoticed, we had a level of acknowledgement to be able to demonstrate that there was going to be a level of engagement to be able to support the employee. So, terms like "thank you for sharing," let's talk about how we can support you. "I'm so sorry to hear this. What is it that we can do to help you through this process?" A lot of these statements are supportive in nature and also giving you an opportunity to acknowledge and pivot. And what I mean by that is that you don't have to get caught up in, "Oh, I have to solve this right now." It is getting a preliminary understanding of how you can acknowledge and be able to begin to support the employee. Now, in that example of "thank you for sharing, let's talk about how we can support you." If you are nervous about that getting very widespread, you can say, "Thank you so much for sharing. I definitely want us to support you with this. I want to be able to work with our HR team or department to make sure that we get you the support that's needed." Very simple. Okay. The other thing that we want to emphasize and make sure that we are thinking about from an organizational perspective is that we are, one, keeping the contemporaneous notes, as I talked about, that we want to link in the EAP, the Employee Assistance Program, in those conversations as quick hits as needed. and or making sure, as I noted earlier, that we're doing HR follow-up. So in this instance, you have an ability to be able to use small statements of acknowledgement and support that transitions to a follow-up with your HR departments and teams or experts. Or you can very easily add in, well, do you know that we do have our employee assistance program? This may be an initial resource that you can engage with to support you. So those are some key ways in which that we as organizations and people managers and HR practitioners can ensure that we are not missing the mark with this increased need for support in this area. And then we want to look at culture versus compliance. As I noted, these can very much get blurred. Over the years, mental health awareness has been something very light, something that we may just pass the EAP flyer or resource to an employee, and that's it. Now we are seeing that there is a need for further exploration, that this is not just about a caring culture, but now that we have a legal duty and obligation to ensure that we are doing our part as an organization. And most importantly, not just our part, but legally that we are not infringing upon an employee's rights. So, one of the things that we definitely, employers and organizations and people managers can do is really begin to think about how to start to proactively design wellness programs that are going to support this. Okay. And I think that this is, again, looking at standalone EAPs versus EAPs that are coupled with your medical insurance or your life insurance. This could be things like designing programs or using tools and resources that promote mental health, well being, exercising, eating healthy, yoga, different things that are that can be supportive to employees. Lots of tools and resources are available. And one of the things that we see is that oftentimes in the cases that the EEOC has seen, one of the number one trends is that employers have been penalized for ignoring stress disclosures and employees that appear to be in distress. And this is what we talked about earlier, is that we have to make sure that when we see and hear of this, that we are not blurring the lines of this being just a employee's personal problem and not a business problem, but that the two can work hand in hand, and that our goal is to prevent and be preventative versus being reactive. So, that's a lot to unpack in this episode, but here are the key takeaways as we wrap up. The key takeaways is that mental health is on the rise. Mental health is no longer just a cultural awareness initiative and activity. It is now potentially a legal duty and obligation. So here's the HR verdict on the matter. If you are serious about wellness, you need to train your people managers. You need to train your HR teams and departments and give them the tools and resources to be able to support you, and ensuring that there are programs and trainings in place that are going to support employees. Empathy without education equals exposure. Hear that again. Empathy without education is going to equal exposure. Wellness isn't just culture, it's compliance. So, as you always hear me say, people managers, business owners, CEOs, business leaders, make sure that you're being intentional, strategic, and methodical in how you manage your HR functions and your people strategy. That can sometimes be the key factor in determining your ability to reduce what I call your risk around people management. Until next time, my name is Renee Trotman, and I am your HR virtual advisor and counselor.